All right, we're here for another set of practice questions focused on our GI playlist. This is helpful for if you're taking Step 2, CK, your IM Shelf, IM COMAT, or even for Step 1 for a lot of these questions as well. Please, as always, like and subscribe, and let's get into it. So, before we start, if you would like to pause the video, you can go ahead and read the question, answer it yourself, so you can test yourself. That's the whole point of these videos. And now that you've done that, we're going to go ahead and jump into it. We have a 48-year-old male who presents with recurrent episodes of hematemesis and melena. He has a history of chronic alcohol abuse and complains of severe abdominal pain, particularly in the epigastric region. Physical exam reveals signs of ascites, and a laboratory test show thrombocytopenia, elevated liver enzymes. Upper endoscopy reveals enlarged and tortuous blood vessels with red whale marks in the gastric fundus. Which of the following mechanisms most likely contributes to the development of this patient's vascular findings? So we're looking for vascular findings here of this patient. And so what I've done this time is I've actually highlighted some of the key things you were supposed to pull out that will really help you with this question. So we'll go ahead and do that. So as you can see, we have someone who abuses alcohol, and he's having pain in the epigastric region. So this right here, that kind of alludes to something pancreatic. Not always, but in this situation where he's having where he's having this vomiting blood, and we see that he has some sort of varices, especially since they've done this endoscopy and we're seeing in these gastric varices. It's showing us in this question that he has chronic pancreatitis in the setting of, or he's having gastric varices in the setting of chronic pancreatitis. So then what the question becomes is what causes gastric varices in the setting of chronic pancreatitis. So if you haven't already deduced already, the correct answer here is A, increased portal venous pressure. Chronic pancreatitis can lead to fibrosis and scarring of the pancreas, which may result in the obstruction of pancreatic ducts. And I've pulled a picture here I'm going to jump to real quick. You can kind of see that. So when you get obstruction here, you can get this buildup of pressure, and it really increases this venous portal pressure. So that's something that's happening here in this question. This obstruction can lead to an increase in pressure. I'll go ahead and jump back to that. Increase in pressure in the pancreatic vasculature, leading to splenic vein hypertension. Increased pressure in the splenic vein can subsequently lead to portal hypertension, a common complication in chronic pancreatitis. So you can see this obstruction. Here's the splenic vein going to the spleen, and we get that increase in pressure, and that causes these gastric varices. As you can see, the pressure building up here because we've now caused that obstruction. Portal hypertension can result in the development of varices in various sites, including the gastric fundus. And so that's what we have here. So now let's go over why some of the other answers are incorrect. So impaired platelet aggregation is not a direct mechanism for the development of gastric varices. Thrombocytopenia, or low platelet count, can occur in platelets with advanced liver disease and portal hypertension, which may be secondary to chronic pancreatitis in this case. However, thrombocytopenia is a consequence rather than a direct cause of gastric varices. So although they're related, it's more of a consequence of the situation. It's not really causing it. So that's what makes B wrong. C, esophageal variceal rupture. Esophageal varices and gastric varices are kind of distinct from each other. While they both are associated with portal hypertension, they occur in different locations. Esophageal variceal rupture would lead to bleeding in the esophagus, not the gastric fundus, where the enlarged blood vessels with the red whale mark are observed in this patient. D, elevated pancreatic enzyme levels. Elevated pancreatic enzyme levels, such as amylase and lipase, are indicative of pancreatic inflammation or injury. While chronic pancreatitis can result in elevated liver enzymes, this is not a direct cause of gastric varices. The development of gastric varices in this context is primarily related to the portal hypertension. And so we can see the distinction here between something more acute versus the chronic is what we're seeing here. And then last, the reduced gastric acid secretion. While potentially related to GI conditions, it's not a primary mechanism contributing to the development of gastric varices. Gastric varices are primarily associated with portal hypertension, as we saw in choice A. So that's going back to here. This increase in portal hypertension is that big thing. So in summary, the most likely mechanism contributing to the development of gastric varices, as you saw in this question, is increased portal venous pressure due to portal hypertension, which can be a consequence of chronic pancreatitis and its associated complications. So there you have it. And once again, go ahead and like and subscribe, and please comment for any subjects you would like to see questions on, and I'll see you in the next one. That's it.